Welcome back.
I'm ready to get into the nitty-gritty of specific drugs,
Hmm?
and how they actually help people breathe easier.
So let's start with bronchodilators, one of the most common and important classes of drugs for respiratory conditions.
Bronchodilators. The name kind of says it all.
Yeah, they dilate
They dilate.
or open up the bronchi.
The bronchi.
Those airways in our lungs, that must be such a relief for anyone
Yeah,
who is struggling to breathe.
I can imagine.
Imagine breathing through a straw that's slowly being squeezed.
Oh, wow.
That's kind of what it feels like when your airways constrict.
Yeah,
Bronchodilators help to widen that straw, allowing air to flow more freely.
that's a really good image. So how do these bronchodilators work? I mean, do they all target the airways in the same way?
Not exactly. There are a few different types
Okay.
of bronchodilators, each working on a different mechanism.
Okay.
Some target beta-2 adrenergic receptors,
Okay.
like the albuterol we talked about.
Albuterol,
Ah,
our trusty rescue inhaler,
yes.
like a quick fix. We needed to open up those airways fast.
Exactly. It's a short-acting beta-2 agonist.
Okay. Meaning it kicks in quickly, but doesn't last very long.
Then there are long-acting beta-2 agonists,
Okay.
like salmeterol, which provide more sustained relief
Got it.
for managing conditions like asthma and COPD.
So it's like having both a sprinter
Mm-hmm.
and a marathon runner on your team,
A great analogy.
depending what kind of breathing challenge you're facing.
Now, another type of bronchodilator is called an anticholinergic.
Anticholinergic.
These medications block the effects of acetylcholine,
That's
a
acetylcholine.
neurotransmitter
Yeah.
that can cause airways to constrict.
So anticholinergics are like traffic cops, directing those acetylcholine signals to stop. Let those airways relax.
Precisely. Ipratropium and tiotropium are examples of anticholinergics that
Okay.
are commonly used for COPD.
And what about methylxanthines?
Yes, but they're not as commonly used as beta-2 agonists or anticholinergics. Theophylline is an example of a methylxanthine. It works by relaxing airway muscles and reducing inflammation.
So we got bronchodilators. They're key players in managing respiratory conditions.
Uh-huh.
There are different types to choose from, each with its own way of tackling the problem. What about other medications that are used for respiratory problems?
Another important class of drugs is corticosteroids. They're powerful anti-inflammatories that help reduce swelling and irritation in the airways.
Okay, so if bronchodilators are like opening up a clogged pipe,
Uh-huh.
corticosteroids are like smoothing out the rough edges inside that pipe.
That's a great way to think about it. They work by calming down the immune system's response to allergens and irritants,
Okay.
essentially telling those inflammatory cells to chill out.
And corticosteroids come in different forms.
They do. Inhalers, pills, even injections.
Yeah. The route of administration really depends on the severity of the condition
Hmm.
and the individual patient's needs.
Right.
Inhaled corticosteroids are often the first line of treatment for asthma,
Uh-huh.
while oral or intravenous corticosteroids
Yeah.
might be used for more severe cases or during flare-ups. So it's like different tools in your toolbox
Mm-hmm.
to tackle inflammation depending on how big the job is. Now, what about mucus? That can be a real problem for people with respiratory conditions.
You're right. Thick, sticky mucus can clog the airways and make it difficult to breathe.
Yeah, and that's where mucolytics come in.
Mucolytics. These medications help to thin the mucus,
Okay.
making it easier to cough up.
So it's like adding a little water
Yeah.
to thick syrup. Makes it more pourable.
Are there any other types of medications that are important?
Yeah, are there other types of medications that are important for people with respiratory conditions?
Definitely. Antibiotics are essential for treating bacterial infections in the lungs,
Okay,
like pneumonia,
got it.
and antihistamines can help to block the effects of histamine, a chemical that can trigger allergic reactions and make asthma symptoms worse.
So it's like a whole team of medications working together to tackle different aspects of respiratory problems. But with so many different drugs out there, how do healthcare workers make sure that patients are getting the right medications at the right dose and in the right way?
That's where the 6 rights of medication safety come in.
Okay, the 6 rights. Let's recap those.
They're like a checklist that healthcare providers use to ensure accuracy and safety at every step of the medication administration process.
Okay, it starts with the right drug.
Right drug. Double check the order, the label on the container, Even confirm with the patient.
Then there's the right dose.
Right dose, making sure that the amount of medication is accurate, especially if it needs to be calculated based on the patient's weight or other factors.
Okay.
And of course, the right patient.
Right patient. It seems obvious.
Yeah, it seems obvious, but in a busy hospital setting,
Right.
it's crucial to verify the patient's identity before giving any medication.
Right.
Always check the wristband and confirm their name and date of birth.
Okay, then we have the right time.
Right time. Medications need to be given at the prescribed times to maintain consistent drug levels and maximize their effectiveness.
Right route is next.
Right route. Making sure the medication is given in the correct way, orally, intravenously, through an inhaler or any other route.
Right. Using the wrong route could completely change how the drug works.
Exactly. And finally, the right documentation.
Right documentation. This involves accurately recording every detail of the medication given. The drug, the dose, the time, the route.
And any observations about the patient's response.
It's like keeping a detailed logbook, making sure everyone involved in the patient's care is on the same page.
Exactly.
These 6 rights are fundamental principles of safe medication administration and a testament to the healthcare profession's commitment to patient safety. Now let's shift gears a bit and talk about something we touched upon earlier, drug interactions.
Drug interactions. This can be a tricky area.
I would imagine so.
Drug interactions happen when 2 or more drugs interact with each other in the body, potentially altering their effects. These interactions can be beneficial, harmful, or have no noticeable effect at all.
So it's like a complex dance.
Yeah. Between multiple partners, sometimes the dance is harmonious,
Right.
but other times it could be a little bit of a stumble.
Right. Drug interactions can happen at any stage of a drug's journey through the body, from absorption to elimination. Some drugs might enhance or inhibit the absorption of other drugs in the digestive system.
Others might compete for the same binding sites on proteins in the blood, affecting how they're distributed throughout the body. And some drugs can even affect the activity of liver enzymes, those busy workers that break down medications, altering how quickly drugs are metabolized and eliminated.
So it's like a complex web of interactions that can have a big impact on how medications work in the body.
Exactly.
And that's why it's crucial to tell your doctor about all the medications you're taking.
Everything, even over-the-counter meds.
Over-the-counter meds, supplements, herbal remedies, give them the full picture of your medication landscape.
Exactly. So they can make informed decisions about your treatment plan.
Okay, let's talk about synergism.
Synergism. This is when 2 drugs work together, like a power couple, creating an effect greater.
1 + 1 = 3.
1 + 1 = 3. Than the sum of their individual effects.
Okay.
Like,
for example, combining 2 different antibiotics might create a superpowered attack against a bacterial infection, killing those bacteria more effectively than either antibiotic could on its own.
that's a good example. Another one is combining a bronchodilator with a corticosteroid to tackle both airway constriction and inflammation in asthma.
Synergism can be a very powerful tool
Yeah.
in treating certain conditions.
It can. But then there's antagonism,
Antagonism.
which is the opposite of synergism.
Okay.
This is when one drug blocks or reduces the effects of another drug.
It's like they're battling it out. One drug's trying to sabotage the other one.
Yeah. A classic example is naloxone or Narcan,
Okay.
which is used to reverse the effects of an opioid overdose. It works by blocking opioid receptors.
Got it. Essentially kicking those opioids off their binding sites, preventing them from having their effects. So in that case, antagonism is a life-saving intervention.
It is.
But antagonism.
But antagonism can also happen unintentionally
Right.
and have negative consequences. That's why understanding potential drug interactions is so important.
It's like having a skilled conductor leading an orchestra. You need all the instruments to be playing in harmony.
To create that beautiful music. Similarly, you need all your medications to be working together
Right.
effectively and safely.
To achieve those best health outcomes.
I like that analogy. It highlights the intricate and delicate balance involved in medication management.
Now let's talk about some specific things people with respiratory conditions can do to manage their medications effectively.
And to stay safe. One of the most important things
Yeah.
is to have a clear understanding of your condition and your medications.
Yes. Don't be afraid to ask questions.
Ask questions and advocate for yourself.
Advocate for yourself. It's your body and your health. You have the right to be fully informed.
Absolutely. Another key point is medication adherence,
Medication adherence.
which means taking your medications exactly as prescribed by your doctor. Skipping doses, taking medications at the wrong times, or stopping medications abruptly can have a big impact on their effectiveness and can even be dangerous.
It's like having a carefully choreographed dance routine.
Yeah.
If you miss a step or you change the timing, the whole performance falls apart.
You got it. Medication adherence is crucial for maintaining control of your condition and preventing complications.
Okay. And what about side effects? It seems like every medication has this long list of potential side effects, which can be daunting.
It's true that medications can have side effects,
Yeah.
but not everyone experiences them. And many side effects are mild and manageable. The important thing is to be aware of the potential side effects of your medications and to report any unusual or bothersome symptoms to your doctor.
Be informed and proactive.
Exactly.
Don't suffer in silence if something feels off.
Open communication with your healthcare provider is key
Yeah.
to managing side effects and ensuring that your medications are working for you,
Right.
not against you. Now, what about those practical tips for taking medications correctly?
Yeah. What are some practical tips for taking medications correctly?
Pill organizers are a lifesaver for that.
Pill organizers. Okay.
They help you keep track of your medications and make sure you're taking the right pill at the right time.
Got it.
Setting reminders on your phone or using a medication tracking app can also be helpful.
And what if you have trouble swallowing pills?
Talk to your doctor or pharmacist. There might be alternative formulations available, like liquids or chewable tablets
Okay.
or capsules that can be opened and sprinkled on food.
Speaking of food,
Yeah.
are there any dietary restrictions people should be aware of when taking medications for respiratory conditions?
Some medications need to be taken with food
Okay.
to prevent stomach upset,
Hmm.
while others need to be taken on an empty stomach for better absorption.
Right. It's always best to check with your doctor or pharmacist.
Uh-huh. About any specific instructions regarding food and your medications.
And of course, always keep medications out of reach of children and pets.
Of course.
Store them in a cool, dry place, and dispose of expired medications safely according to your pharmacist's instructions.
Absolutely.
Safety first.
Safety first.
Now let's shift gears
Yeah.
and talk about a concept that we introduced earlier, pharmacodynamics.
Pharmacodynamics, the study of what drugs do to the body and how they do it.
It's like understanding the inner workings of those medications and how they produce their effects.
Exactly.
We know that albuterol, for example, binds to beta-2 receptors in the airways.
Right. But pharmacodynamics helps us to understand the whole chain of events that happens after that binding, ultimately leading to the relaxation of those airway muscles and easier breathing.
It's like tracing the steps of a complex dance.
Yeah. Understanding how each move contributes to the overall performance.
Yeah. Pharmacodynamics helps us to appreciate the intricacies of how drugs interact with our bodies on a molecular level.
That's a great way to put it. And understanding pharmacodynamics is essential for developing new and more effective medications.
Right, with fewer side effects. Now let's talk about drug potency.
Drug potency.
Which is a term I've heard before, and I never really fully understood.
Drug potency refers to the amount of drug needed to produce a specific effect.
Okay, a highly potent drug requires only a small dose to achieve that desired effect.
While a less potent drug might need a larger dose.
So it's like the strength of different spices. You might only need a pinch of cayenne pepper, add some heat to a dish, but you might need a tablespoon of paprika to achieve the same level of flavor.
Drug potency is an important consideration when determining the appropriate dose for a patient.
Okay.
And it can also vary depending on the route of administration.
Oh, right. For example, a drug given intravenously might be more potent than the same drug taken orally. Because it bypasses that first pass metabolism in the liver.
That's a great point.
The route of administration can really influence a drug's potency and its overall effects. Now let's talk about a concept called desensitization.
Desensitization.
Which happens when a person's body becomes less responsive to a drug over time.
Right. Desensitization can happen for various reasons.
Okay. And it can be a challenge when you're trying to maintain a consistent therapeutic effect.
Sometimes it might require increasing the dose of the medication.
Okay. Switching to a different medication or taking a break.
from the medication altogether to allow the body's sensitivity to reset.
So it's like our cells are basically saying, we've seen this drug before, we're not impressed anymore.
That's a good way to think about it. It's a complex interplay between our bodies and the medications we take. And it underscores the importance of ongoing monitoring and adjustments to treatment plans as needed.
Now let's revisit a drug's half-life.
The half-life of a drug is the amount of time it takes for the drug's concentration in the body to decrease by half.
So it's like a countdown clock
Exactly.
for the drug's presence in the bloodstream. The half-life of a drug is crucial in determining how frequently it needs to be administered to maintain those therapeutic levels in the body. For instance, albuterol, with its relatively short half-life of 2 to 5 hours, needs to be taken every 4 to 6 hours for sustained relief. In contrast, some medications, like long-acting bronchodilators,
Have much longer half-lives, allowing them to be taken once or twice a day, while still providing continuous control of symptoms.
Okay, so understanding a drug's half-life helps us to determine the appropriate dosing frequency to maintain those therapeutic levels and minimize the risk of the drug building up too much in the body.
It's a delicate balance between maintaining effectiveness and minimizing potential side effects.
Now let's shift gears
Yeah.
and talk about a very serious topic, drug overdoses.
An overdose occurs when someone takes more medication than their body can safely handle, whether accidentally
Okay.
or intentionally.
Okay.
The severity of an overdose really depends on the type of drug.
Right. The amount taken. Welcome. I feel like we've covered a lot of ground, but I know there's still so much to explore.
Yeah, we've talked about those general principles of pharmacology,
Right.
the importance of medication safety, the complexities of drug interactions. Now let's shift our focus to
yeah.
some specific challenges and future directions in this fascinating field.
One challenge that comes to mind is medication adherence.
Yeah.
It seems simple enough.
Right.
Just take your meds as prescribed, but I've heard that it's a bigger issue than many people realize.
You're right. Medication adherence, or the act of taking medications as directed, is crucial for achieving the best possible outcomes. But studies show that about half of all patients with chronic conditions don't take their medications
Wow.
as prescribed.
That's a big number. Why is it so hard for some people to stick to their medication regimen?
There's a lot of factors at play. Sometimes it's forgetfulness, busy schedules.
Right. Other times it's the cost of the medication. Concerns about potential side effects. I imagine taking multiple medications with complex dosing schedules could be overwhelming,
Yeah.
especially for older adults
Uh-huh.
or people with cognitive impairment.
Right. And some people might not understand the importance of taking their medications as prescribed.
Yeah.
Or they might have concerns about potential drug interactions.
So what can be done to improve medication adherence? Are there any strategies that have been shown to be effective?
There are simplifying dosing schedules,
Okay.
using pill organizers or reminder systems,
Right. Yeah.
and providing clear and concise patient education about the importance of medication adherence.
Okay. Can all make a big difference.
Addressing financial barriers
Right.
to medication access is also crucial.
It sounds like a multifaceted approach is needed,
It is.
taking into account the individual's needs and circumstances
Exactly.
and open communication between the patients
Mhm.
and healthcare providers is essential.
It is.
Patients should feel comfortable discussing any challenges they're facing with medication adherence, and healthcare providers should be proactive in identifying potential barriers and working with patients to develop those individualized solutions.
Uh-huh.
Now let's look ahead. What are some of the exciting advancements on the horizon in pharmacology for respiratory diseases?
One area that holds immense promise is the development of targeted therapies.
Okay. That focus on specific
Yeah.
molecular pathways involved in these diseases.
It's about moving away from that one-size-fits-all approach.
Right. And towards more personalized treatment. So instead of using a shotgun approach, we're moving towards a more precise sniper rifle approach.
Exactly. Target therapies aim to be more effective
Yeah.
and have fewer side effects because they're honed in on those specific mechanisms driving the disease.
That's incredible. What other advancements are in the pipeline?
Another exciting area is personalized medicine,
Personalized medicine.
which
Right.
takes into account
Right.
an individual's unique genetic makeup, lifestyle factors, and other personal characteristics to tailor treatments
Okay.
for optimal effectiveness.
So it's like custom designing a medication specifically for you.
Oh, got it. Based on your unique blueprint, personalized medicine holds the potential to revolutionize how we treat respiratory diseases and other conditions.
Leading to better outcomes and fewer adverse reactions.
Yeah.
Are there any cool technological advancements that are changing the game?
Definitely. Researchers are exploring the use of nanotechnology to deliver drugs directly to the lungs. Imagine tiny nanoparticles carrying medications directly to the site of action, improving effectiveness and reducing systemic side effects.
So it's like having a microscopic delivery system.
Exactly, ensuring the medication gets exactly where it needs to go. These advancements in pharmacology offer hope for a future where respiratory diseases can be managed more effectively.
Right, and with fewer burdens on patients. It's inspiring to hear about all the progress being made. It gives me hope for a brighter future
Me too.
for people with respiratory conditions.
It's a testament to the dedication and ingenuity of the researchers and healthcare professionals who are constantly pushing the boundaries of what's possible.
Well, we've reached the end of our deep dive into pharmacology for respiratory diseases. We've covered a lot of ground, from the basics of how drugs work, to the complexities of drug interactions, and the exciting future of this ever-evolving field. I hope this deep dive has empowered you with a better understanding of your medications and how they impact your respiratory health. If you're curious, remember, knowledge is power when it comes to your health. And that wraps up another episode of Deep Dive Med. We hope you found this deep dive insightful and engaging. Don't forget to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.